Esiet sveicināti un prieks, ka esat pievienojušies. Šis ir raidieraksts Inovācijas veselībā. Mani sauc Kristaps Talbergs, un šajā raidierakstā mēs runājam par veselību un inovācijām. Veselībā kopumā medicīnas jautājumi tiek apspriest šeit daudz un plaši. Un arī šajā reizē mēs runāsim par tēmu, kas skar ne tikai medicīnu, bet arī valstī kopumā. Veselības aprūpē bieži tiek, veselības aprūpe kā tāda bieži tiek uztverta kā tādas izmaksas un atkal izmaksas, un viņi atkal prasa, un tas atkal mums kaut ko maksā, bet retāk tas tiek apskatīts tiešām tādā būtiskā investīciju formātā un kā investīcijas, un tik tiešām, ka tas pēc tam atmaksājās sabiedrības noturībā. Un par to, kā veselības investīcijas pārvēršas reālos rezultātos un kā Latvija izskatās starptautiskajā kontekstā, šodien mēs runāsim ar starptautisku veselības, ekonomikas un politikas ekspertu, un mūsu saruna tālāk jau būs angļu valodā, and our conversation with Dr. Slaveyko Djambazov, a health economic and policy expert from Bulgaria, who has advised governments and international organizations on healthcare system development, financial models, and access to innovative therapies. Hello.
Labdien, Kristaps, dāmas un kungi.
Oh, nice. Your Latvian is improving.
That's the only one that I can declare as an improvement.
Yeah, thank you, sir, for joining this conversation, and it is really great to have you and that you could share your analysis on the things that you've noticed and have seen across Europe, and particularly across the healthcare in Latvia. And we're going to start with some broader questions, and then we're going to close up in some particular issues. When we talk about the healthcare at the national level, is the core problem still that it is perceived as a cost rather than a strategic investment in countries' development?
That's a very advanced question, so you obviously prepared very well, and it's not Latvia specific, it's not country specific, it's not Central Eastern Europe specific. We see that all over the world. And the main difference is that when we talk about costs, we want to control them, we want to suppress them. The cost of electricity, we wish it to be zero, right? When we talk about investments, we want to proliferate those. Like if we invested, let's say, in gold like 6 months ago, 1,000 euro, now we're going to have 1,400. And we want more of that, like doing it smartly, not in a risky way. And the difference is here is that in one thing is that we just measure the money that we put there. And when we talk about investments, we measure the return on investment, what we get out of this money. And this is where healthcare is heading. What outcomes are we getting out of the money that we put in healthcare? That's why in many countries, and including in my presentation for the tomorrow's event, is that I didn't put healthcare spending, I put like healthcare investment, because we already have returns, so we can measure what we achieve out of the money put there.
How would you explain the link between healthcare funding and economic growth? How direct and measurable is it?
In the case of Central Eastern Europe, it's very measurable, and it's already a pain, no matter if we feel it or not. And it comes from, so first we are in wartime. In wartime, life depreciates, and when life depreciates, the first budgets to be attacked will be social budgets and healthcare budgets. We haven't seen that. Hopefully we won't see that, but the defense budgets already are increasing. The mid and longer term effects that we're going to see is the aging of population, and with aging comes a lot of challenges. For example, for Latvia, in 2050, 31% of the working population will be gone. It will be either dead or in aging, like not economically active, which means that they will produce less. And there is another dimension of this fiscal squeeze, because those who are elderly, they need more money for healthcare. like between 3 and 4 times more money above the age of 55 until the age of 55 in Central Eastern Europe. So we're going to need more money. We're going to have less people working. So we need those less people more active, which means alive with less disabilities, healthy. So that's why we need healthy people to work in the economy, and so we're going to have an economic product for everybody, for those who are kids, for the working class itself, and also for the elderly population in need of health care.
And definitely the quality of life, that it is improved with the good health.
I mean,
it's basic.
We cannot talk about any quality of life in good terms when there are diseases. The good thing is that the medicine is evolving. So we have a lot of solutions that we can address these kind of diseases, especially the non-communicable diseases like cardiovascular, metabolic cancer. So we can keep this quality of life higher for those patients who are already diagnosed.
Latvia invests around 4 to 5% of GDP in healthcare. How sustainable is this level in long term?
Latvia, unfortunately, is the country with the least investment in healthcare in terms of percentage of GDP per capita, 4.4. So for the EU 4 countries, which are France, Germany, Spain, and Italy, it's about 5%. For Central Eastern Europe, the average is a little bit higher than 5, which means that Latvia invests less money. That's not exactly bad news. Yeah, because it means that you can do smart investments. So when you have a legacy system already invested like 5 or 6%, it's very hard to change. While when you come from a lower level, you can plan very well where you're going to get the best outcomes for your society, for Latvia specifically. So I would consider that a good potential for your politicians and the ecosystem as a whole.
That's a good news.
Yes, I tried to get one.
Thank you.
Yeah.
You know, talking about the healthcare system in Latvia, we really listen to every single good news that there is. So you're saying that basically that the investments are maybe lower and that we are putting some more that gives us advantage, that we can really decide and pick, that it is not the case of, oh, we have overspending and we don't know where this money is leaking and so forth.
It's a huge, very complex and complicated system, the healthcare system, and with a lot of inertia, with a lot of regulations. And if you want to change it, it's really hard. But if you want to build it or upgrade it with some incremental changes, this gives you a very good chance. This gives the country a very good chance.
But at the same time, we still need to improve in that a lot, because that really benefits the society. Pro-living, we're just living longer. So that is not an economic burden to those still working. So what would be the target? Would it be the 6%?
Any target higher than this one is better. The question here is how you can do it smartly. There are ways to do it smartly, but let's go back to the impact. So life expectancy is one measure. But we don't need only people to be alive. We need them active. We need them with less disabilities. And the largest problems for the countries which are at the bottom in Central Eastern Europe, including the country that I come from, Bulgaria, is the treatable mortality, which means those deaths who can be prevented if the patients are diagnosed on time and treated properly on time. And in Latvia, there are 3 times more than the EU 4. So Latvia is losing 3 times more people every year than EU 4, which is like pandemic scale loss of life, you know, and there are no shocking news and no breaking news. It just happens every day.
And those are treatable.
Yes.
there's medicine, there's drugs, there's
There
everything is there.
Early diagnosis, screening programs, innovative treatment that can be used in those patients. Yes, these are treatable deaths.
And those particular cases, it's not like some kind of a woozy-doozy kind of stuff, very innovative.
It's not schickimicki.
Experimental.
It's measurable.
Yeah.
It's measurable. These are population health outcomes which are used all over the world. And when you look at the data in Central Eastern Europe, one thing is clear: the more money you have as a country, the more economically developed you are, the less treatable mortality you have and the less disabilities you have. And it's a correlation which is for every country. But we also looked for another thing. I mean, the richer, the better, that's clear in every dimension of our life, but it doesn't mean smarter. And that's why we looked also how the healthcare investment, public healthcare investment per capita is spent and what are the outcomes. And there we see the same thing. The higher the public healthcare investment per capita, the lower the treatable mortality, the lower the deaths. So the question here, the same for net pharmaceutical spending. The more money you spend in pharmaceuticals, innovative drugs, the less disabilities, the less treatable mortality. And the question here, back to where we started, where to invest? Let's assume we have the money. No country has the money. Switzerland, they don't have the money. I mean, but you have to do something. You have to plan the investment. So let's assume that you have the political will to do it. Where you start from, where you can measure the return. That's
the life expectancy.
Life expectancy, disabilities, wherever. But it's about national priorities. It's about your local environment, local decisions. It's not about some people coming from somewhere tell you what to do. You know very well what to do. What I can tell is how you can measure so you can be sure that you invest money where you can get the best return.
You have done the healthcare analysis all across the world and country by country, and really focusing on this economic issue on that. I did some rough calculation, and I would just love to hear your thoughts about it, and if there's any particular kind of, yes, this is broadly how it's basically done, but would it be true if we take the annual deaths, the death base here in Latvia, we in 2023 the official death was 28,000, and if we assume that we can only 10% of those would be prevented through the effective treatments, and all that. That would be roughly 2,800 lives saved or prolonged for like 5 to 10 years, for example. And if only half of that would stay economically active, then for like 5 to 10 years, there is a simple math and calculation how much each person adds to the GDP annually.
Yep.
Then we come across the number for around 300 to 600 million euros would be gained for the Latvians' economic or GDP. If only those, around 1,000 people would prolong their life and quality and be economically active, would be in the area that it is more or less calculation correct?
Exactly. I see my job is threatened not by artificial intelligence, by natural intelligence. Yes, these are the calculations that we're doing. And this is common sense. Mm-hmm. It's common sense.
It's not the bureaucracy or
exactly.
some kind of, this is simple math.
Exactly, it's simple math, and the elderly population in our part of the world is a lot more economically active that we actually calculate, because they help for the kids, they help for the house, they have a lot of non-monetary contributions to the society, which also can be calculated. My point would be that we don't need more calculations. I mean, we can academically adjust this throughout the year. We need more decisions, and we have enough data to make decisions. Of course, there is an uncertainty. There will always be an uncertainty. That's why we have leaders, because if we have an absolute certainty, we don't need leaders, we need executors. And we can manage this uncertainty with risk sharing. We can face this risk like in many other areas. It's just that healthcare should be a priority. It's not about the quality of the data, the quality of analysis. There is a return. We have people who are with less disabilities. We have people who are more active. That's clear. We just have to choose which uncertainty to tackle first.
What have you seen in other countries and also in Latvia? Where's the problem? Why is this not heard? Of course, the first and main answer would be there's no money. We have not enough money.
It's not about not having money. So I've worked in some African countries. I've worked in many exotic destinations around the world. It's not about lack of money. We have money. We don't have the money we want to have, but we have money. The idea is how you invest them. So it's like you see a family with working people who are not investing enough for their retirement, who are not investing enough for their kid, and you feel sad for them. Why do they have to do that? Why they spend all the money on trips and alcohol and drugs or whatever? So it's practically the same. Are you smart enough to start from somewhere? It won't happen overnight. It won't happen that Latvia is going to discover a big oil deposit in the Baltic Sea and the money is going to flow. No, it's everyday habits, everyday work that we do changes our lives and improves our lives. So we need smart policies. The politicians, I believe that they're afraid of the uncertainty. So that's why when I speak to politicians, I try to turn everything in euro, because doctors, clinicians, everybody speaks about lives. Politicians, decision makers, they speak in money. Every disease is important. Every patient is important for them. So they need to know, if I put this money here, what is the level of uncertainty, what I will get back in terms of economic contribution, in terms of outcome for the patient.
My voters will notice this?
And I can communicate it with the voters then, and I can measure that, and I can share the risk with the provider, be it a hospital, be it a pharmaceutical company, medical devices company, or whatever. So they need more tools. And we have countries where this happened. And everybody got through this evolution from those countries who are much better than us. And the one common thing is they work together. Patient organizations, scientific societies, politicians, industry, media, if you wish, they work together. That for me is number one.
Yeah, because I wanted to ask you about this kind of improvement step. Because, of course, we always can look at those EU4 countries that really have a nice healthcare. They're more wealthier than us. And then there's countries catching up, making right decisions, making right policies, and really acting on them. What have you seen? What are those like 2-3 directions and decisions, what they did?
Yeah,
because maybe 5-8 years ago, they were in a similar situation.
In 30 years ago, we were all from the Eastern Bloc, we were in the similar situation. And now when you look at Czech Republic, Slovenia and Poland, Croatia as well, are very good examples. And what we see there is, first, they tackled the uncertainty. So they introduced the so-called health technology assessment. They assess every new technology. So somebody comes and claims, we are very innovative, we're going to change the world, we're going to bring that kind of outcomes. Fine, we accept this data, and after that measure in real life, is it true or not, and based on that we negotiate on the price. That's one thing. The second most important thing is they work together. I have to say it again, but it's not a unique knowledge that somebody has it. It's not the health economists, it's not the patient organizations, industry or scientific societies. They work together and they decide what to do. So all these platforms are very important for open communication and common decision making.
Let's talk about some innovative treatments, because we are in, I think, the last place in Europe.
One of the last places.
Yes. How that would change the life expectancy and health as itself, if we could get those treatments faster and in bigger scale.
So this again is back to the main topic, investment. So when you invest in something innovative, you have to measure the outcomes. So we have diseases like cardiovascular diseases, metabolic, mainly diabetes, but obesity as well, and cancer. And there are treatments that we know that either reduce the disability, improve the quality of life, or improve the life expectancy in those patients. So we need to know when to apply this innovation into which patients, and that's why there are country-specific criteria, country-specific guidelines. Usually they're very much compliant with the international guidelines, but there are also country-specifics. So together the scientific societies, industry and decision makers can develop those, and based on the uncertainty, the budget uncertainty, which we discussed for the politicians, they could be risk-sharing agreements between the political bodies like Ministry of Health or the Health Insurance Fund and the manufacturers of those drugs. So you claim this kind of efficacy, but when we see in real life, sometimes it's higher, sometimes it's lower, we can adjust. And this is the way you do, like when you buy a car, you get the guarantee. And if something goes wrong, you're not paying for that. The risk is transferred. So it's practically the same on a larger scale. The main problem here is that we don't have very robust outcome measures. And this is the very important role of the clinics and the scientific societies.
How to treat the whole maybe skeptical part of the innovative treatment? Oh, well, those are just too expensive. It's just we still need to figure out the basic health care, and then those maybe rare health diseases, and that is costing a lot.
The moment you mention expensive, it means that we treat that as cost. So let's go back to the gold example. We put 1,000 euro 6 months ago, now we have 1,400. Why didn't I put 100,000 euro? So that's the question. How I can do that more without the risk, of course, but because I'm just giving an example of gold, but it can go down, we don't know. But here, with a certain level of certainty, we can expect outcomes. So the main question is, how do we afford that? Not that it's not the question, shall we do it? Of course we have to do it. There is a return. We're going to have less disabilities. We're going to have a better quality of life. We're going to have better life expectancy. How do we afford it? That's the main question. Where do we get the money from? And this is the allocation of money that should be done. It's not easy at all. And that's the hardest part for the politicians to do.
Let's talk about the system effectiveness and political decisions. To what extent is the issue in Latvia not just the lack of funding, but also slow and complex decision-making processes? You talked about working together. Sometimes when the issue would be there's no money, or there's some other very tough decisions or something. But when you mention you just work together, it's just like ridiculous. Come on, let's just group up. Let's have a working day, and then let's make it happen. So, how does those issues affect the healthcare and the life expectancy if that all the decision making is very complex?
It's really complex. It's not easy. That's why it's usually delayed. all this delay, it costs life. The delay of access to treatment, the delay of reforms, the delay of needed investment, it costs lives. And once we understand that, and once there is a political will, and I would say leadership, this changes. And when I say leadership, I mean people who are ready to embrace the uncertainty. There is nothing certain, and it gets more and more uncertain, as we see. Not only healthcare, I mean globally. We cannot sit and wait. We have to do something. I mean, from 1,200,000 working population, Latvia is going to have 800,000 in 2050, and that's for sure.
Yeah.
It's very hard to change that. So you have to do something, and you have to do something now. I love to say there is no bamboo in the healthcare forest. Everything grows very slowly. That's one of the reasons of the political resilience, because within a mandate, they cannot see the results. They cannot go to their voters and say, look what I did. So it needs more explanation. And what I believe is that, for example, you, the journalists and the media, should help the politicians how to communicate this. They don't know. They don't know how to communicate it. We, as health economists, we have to help them and get all the data into euros, so they have more certainty and they know what kind of risk-sharing agreements they can sign. And so everybody should contribute.
And in some way, if politicians would feel safe,
yep,
they would sign a paper, they would be more active, they would really make the right decisions and go for it because they see the return.
Exactly, and they're in the leadership role, and our role is to support them into making the right decisions.
Why do other countries manage to introduce new medicine much faster? And what different is in their system?
They just reduce the time to reimbursement. So in Latvia it's like 2 years since registration in EMA, so it should be shorter. They either have separate funds that they dedicated to innovation, or they just increased the budget. I mean, like very well forecasted increasing of budget. So all the parties in this system, they need predictability. So we need to know how much money are we going to invest into this. We need to have some expectation on the outcomes, and we need to measure. So the predictability should be on all sides. And again, back to what we discussed, it cannot happen with only one stakeholder. All stakeholders should work together.
Because it sounds really, really tough and crazy that if somebody's health needs a medicine and he knows that it's not something new, it is rare.
Yep.
The treatment is there. It costs a lot, and it's not available. Because you're in Latvia.
So if you're in Angola, for example, and you know that it's not available, and you know that there are no means, you just accept it. We're in European Union, and you know that it's available for people in Slovenia, in France, Germany, Bulgaria, or Croatia, and it's not available for Latvia. And then it's the most pressing question: why? Why do they have it and I don't? Mm-hmm. And this is the gap that we need to close between Central Eastern Europe and EU4 and the other.
If the processes in Latvia were simplified and accelerated, how quickly could the country move closer to the average European health treatment?
Theoretically, very quickly. Practically, it will take time. The main goal is to move. Start doing something. Start increasing the budget. Once you allocate it and you look at the return, you're going to be more confident into more increase. Mm-hmm. It's like any other budget. You don't just shift huge budgets from here and there. It doesn't happen. Mm-hmm. The loss of life is a slow loss of life. We're losing a lot of lives, but they're not visible. There are no breaking news. So there is no pressure. So there should be pressure for that. but not pressure like we want to be like EU4 in 2027. It's not possible. But we want to get closer. We want to get closer.
In some way, I would say that is really a question of protection and safety of a country's independence. And
it's a smart thing to do.
Yeah. Let's finish up with one more. And if nothing changes, what will be the consequences for the healthcare system? 15 years?
You have the answer because you calculated that. Yeah. Huge loss of life and huge loss of economic potential. Mm-hmm. We just lose.
Yeah.
I mean, if we don't do anything, the cost of doing nothing is very high. We have to do something.
Thank you. Maybe to round this conversation up, your wish for Latvia as a doctor, and if in your office would come a patient and his name would be Latvia, and you know all the history and everything, what would you say?
I'm not a practicing physician, thanks God, because this is not an easy job. But for Latvia, put hard questions to your politicians. Vote, always vote. Without voting, you cannot change anything. But put hard questions. And if you feel that healthcare is important for you, you have to do two things. One is take much better care for you and your family, your loved ones, make smart choices. And the other one, in the public domain, be more active. Ask the tough questions, try to provide the answers, try to help those people make better decisions.
Thank you very much for this lovely conversation. Dāmas un kungi, paldies, ka pieslēdzāties un skatījāties. Šis bija raidieraksts Inovācijas veselībā, un mēs sarunājāmies ar Slaveyko Djambazovu, kurš ir izcils eksperts, lai pētītu veselības nozari un, protams, to, kā tas ietekmē valsts ekonomiku. Lai mums izdodās uz tikšanos citos ierakstos. Atā!